Now, from the desert's news leader, KESQ News Channel 3 HD, live at 5.
Melanoma is the most deadly form of skin cancer and normally associated with older people. But a new Mayo Clinic study shows the rate of the disease is rising among people under the age of 40. News Channel 3's Mark Blaine has the details on the study and expert advice on how to reduce the risk of skin cancer.
Dr. Timothy Jochen, a board-certified dermatologist, has read the Mayo Clinic study that indicates melanoma is becoming more common in young adults. Researchers examined a database of patients in Olmsted County, Minnesota, and looked at first-time diagnoses of melanoma in patients between the ages of 18 to 39 from 1970 to 2009. The study showed melanoma cases increased 8-fold among women during that period and 4-fold for men.
Young people still think it's attractive and healthy to have a little bit of a tan. In fact, they say that teenagers will use tanning beds before they have a prom or before a special event. And so that may be associated with the increased risk of melanoma.
43-year-old Jennifer Caulfield, who lives in San Francisco, is trying to get as much safe sun as possible during her visit to the valley. She can't imagine why anyone these days would risk their health by resorting to tanning beds.
It's amazing to me that people would do tanning beds. I did, in the 80s when I was in my teens, but, even then you kind of knew. It probably wasn't good.
Whether you're enjoying yourself at the pool or going through your daily routine to avoid skin cancer, it's important to always protect yourself from the sun.
You want to wear sunscreen on a daily basis, pick out a SPF of 30 and above, reapply your sunscreen, avoid the peak hours of the day, and just be smart when you're out in the sun.
At the Palm Desert Aquatic Center, everyone we spoke to was already taking the doctor's advice. Even the 18-year-olds. You're not going to be someone that's going to go out and take the sun on unprotected?
No, never. I don't want to get a sunburn.
Yes, I'm very fair-skinned and I get burned really fast, and it's important to put sunscreen because sometimes I'm kind of allergic, but not that bad. So I always put on sunscreen. It always helps.
And in fighting skin cancer, especially the most deadly form, melanoma, doctors say early detection is the key.
Melanoma is the most deadly form of skin cancer. And the great thing about melanoma is that if you catch it early, it's completely curable. So you want to keep an eye on your body and make sure you're looking for unusual marks and seeing a dermatologist if you have them, because we can prevent melanomas from becoming deadly in your skin.
Mark Blaine, News Channel 3, Palm Desert.
And how do you know if you're at risk for melanoma? Well, go to a dermatologist and get a full body exam. You'll find out if the spots or moles on your skin should be tested or if there is nothing to worry about. A dermatologist will also recommend how often you should get an exam. Some people should be checked out every 6 or 12 months, others may not.